I'm warning you now, this segment could go on for like 5 days.
I got to read it.
Dr. Doug Waldrep, father of one Caroline Waldrep, who you may be familiar with. I was shown a text from his daughter saying, you're supposed to represent this morning. How are you?
Okay, I'm doing my best.
Good to see you.
Doing very good, Bob. It's great to be here.
So we were talking in the commercial break about what we're going to talk about today, and you and I can talk about a lot of things.
Right.
We're touching on a very serious thing today.
Certainly. World
Suicide Prevention Day.
Yes.
It's sad that we have to denote a day about something as severe as something like this.
You know, Bob, you're right. It is sad that we have to devote a day, but it's important, too, to bring that awareness up for everyone. World Suicide Prevention Day highlights the fact, I guess highlight's not the best word, but it brings forth the fact that almost 800,000 people in the world kill themselves yearly. In the United States alone, that's like 40,000 people. And so what happens when someone tries to commit suicide? How do people respond to that? So the theme of this particular World Suicide Prevention is reaching out. And I think that's extremely important because suicide is such a depression is such a personal illness that it's hard for people with depression to reach out. So I think it's more important for us to be able to recognize it and be able to talk to those who we think might be depressed or maybe be at risk for suicide.
I know I was reading last week in Japan, it was a specific day which really threw me, that they had targeted as the #1 day for suicides in Japan, and they related it to the first day of school and how stressful that can be for individuals.
Yeah.
Is something like suicide, I mean, can you pigeonhole it to where it does affect one age group more than another?
Well, yes. The statistics, we can look at statistics, of course. There's two peak times that suicide is most prevalent, at least in the United States. One is in the ages 14 to 25, very high. It's like the third leading cause of death. I think the first is listed as accidents. Now, it's interesting about that because accidents can also be suicide.
Sure.
And sometimes people would rather put down accident than a teenager or a young 21-year-old with a lot ahead in their life try to kill themselves. So that's important to keep in mind. The other time is older folks between ages of 45, 55, and 65. That's another peak time. So those are peak times, and if you look at that, those are important times when you're growing up, you're trying to establish your independence. Are you going to be successful? Find someone to have a relationship with and be happy. And if you don't, it can be quite devastating.
Sure. I know before they'll start to wrap us up, I just want to get to quickly warning signs that maybe as a parent, as a friend, what you should be looking for.
Yeah, that's important. If you know someone and you suddenly see them changing and they're isolating more, they're not as excited to go out and do things with you. Maybe they're not doing the things they enjoy doing. If they're talking about death or not wanting to be here, it would be a sure sign of you got to take that stuff seriously. Talking to someone about suicide does not increase suicide. Okay. It will decrease suicide. If you see someone changing their habits, drinking or using any substance more, very important that you look into that because that increases the chance of suicide by 6 times the national average. So a sudden change, anyone you know and love, is worthy to reach out and say, how are you doing? How are you feeling? Can we talk about it? And see where they're going. And bottom line then, if your instincts tells you there's something wrong, trust your instincts. Make that call. And there's suicide hotlines that you can call. You can call 911. And if everything is fine, it's okay. But if it's not, you may have saved that person's life just by reaching out and making that decision.
And one thing I always say is if you do have a question about anything medically related, you always want to call a physician to get their advice on things. Yeah. And if you can do it with this guy, see him in person because he smells fantastic.
Yeah.
Well, good to see you.
See you.
We're back with more after this.
You're watching Fox Wilmington.